Hi, this is Dr. Tamara. Hope you are doing well with good health. Today I am here with a new books review that is absolutely amazing and good book which I have just studied. Hey, let's begin with the cover page. The cover page of the book looks exactly like this, and the back cover page is like that. Yeah. So first of all, thanks to Bijan Publications for publishing this nice books, and it's really informative and effective, I think, and hope students will get effective from these books. So before starting, let's talk something about the author. Dr. Aditya Pareek is none other than a third generation homeopath who is the director of the Pareek Hospital in Agra. And we're lucky enough that he has inputted with evidence-based case on his book, but exactly taken from this hospitals or his experience, and really it gives you the ideas of how miasms is coincided and clinically the practice can be done. Yeah. So now coming to the preface sections where it is started in the middle portions, I wish you will read with me too, for the reason I have given it in the screen, that the difficulty lies not so much in developing new ideas as in escaping from old ones. We the people usually try to escape from the situation. Escapism has become so much habited for us, right? Yeah, no? So Dr. Aditya Pareek has given this quote of father of modern economic John Maynard Keynes by making it collaborations with Hahneman's idea and viewpoints of chronic disease. And on the next paragraph is written briefly why he is telling so. So there is no way of escapism, right? So 1,000 likes to Dr. Aditya Pareek, and yes, with this line, with great inspirations, we can move forward for studying the whole book. All right. So in the content sections, it's totally divided into three sections. First sections is the theoretical part, and introduction sections, it's not too small, around 20 page introductions is given, and but it would not become bore, I promise, because there is so much pictures in the pictorial forms, flowchart forms, all the information is given. All right, and then the principles of anti-miasmatic treatment sections comes, and here you will get total idea and viewpoints, and especially the book special advantage, and I like too much that here the reference that it is exactly taken from the chronic diseases volume 1, volume 2, which page and which paragraph is given here, so that you can go and cross check, or you want to study it briefly from the chronic diseases, you can do it. Yeah. So then the other things coming where the mainly three miasms of Hahneman, Sora syphilis psychosis is described here around 4 points, like history of its development, how it's infecting others, and mostly how it differentiating with other miasm, what will be the manifestation and its establishment after infections. So stage wise, it will be clear for you. Now the second section coming, that is symptomatology and remedies. Wow, these sections I really enjoyed, because we usually think of this patient is going towards psychotic patients, so which remedies should we think of? Yeah, from various sources and books and practical experience we get the ideas, of course, but here also enlisted some medicines which will give you, and obviously will be helpful in your practice. And the most important and very nice sections I got, that is in UG sessions usually felt very doubt that what will be the general symptoms of SORA, what will be the head symptoms of syphilitic, mental of SORA and psychotic. Sometimes I get confused. Yeah, these things is also present in this medicine. So this medicine is towards psychotic, so it should be psychotic, but it gives towards SORI. So here the mind generates head, every system wise given it so nicely in other systems like female genitalia, urinary systems, cardiovascular. The miasm wise and system wise you can correlate that which symptoms will produce by which miasm symptom. As for example, single one example I'd like to give, that in mind sections I got, which scratched my mind very nicely, that in case of psychosis patient, psychosis miasm, we think of suspiciousness, right? So if OCD patient of psychosis comes, what will be his or her manifestations? And if OCD patient of syphilitic, then what will be their manifestation? So in case of OCD patients, we know that they used to go back and check that whether they have locked the door, it is done or not. So in case of psychotic, the suspiciousness will come with self-confidence lost. Yeah, there is no self-confidence in case of syphilitic. Or in case of syphilis, the patient will forget. They have the dull, stupid mentality. They have the forgetful memory. That's why they are forgetting. So they are going back and checking that the key is locked or not. But in case of psychotic, they have the self-doubt. So these sections really I enjoyed, but I have just given one example, but in other sections too, there are examples available. All right. In the third section, so wow, really, I liked and enjoyed this section because there are around 4 cases that is uncommon with evidence-based reports has been given. One case I like to say that is around in 19 number cases, that is Haley disease. Yeah, this disease by name, trust me, before that I did not know what it is, but after I have seen, oh my god, it's so easy one. Yes, it's the chronic pemphigus. So chronic pemphigus, how it developed and how the miasmatically it was cured properly is given in the case. And other some interesting cases is given also there, you will enjoy it. Yeah, so we have reached on the last sections, that is potency abbreviation sections, and here nicely given what does it means by what becomes very difficult and sometimes confusing for students, that what is D decimal potency or C centesimal potency, and very informative 2 portions here I got and I enjoyed too much, that is LM we usually use for 50 millisimal, right? For L we think of 50 and M for its 1000, so it is 50,000. But here it's clearly written that this name LM is technically incorrect, as LM when written together it indicates 950, not 50,000. Before reading this book I never knew that. But after Google search, yes, I have gone through the Roman written numerals and they are right. LM potency is 950. But here it's using for long term, so we are accustomed with this writing. No issues. Let's move forward. So almost overall, this was the what this book exactly content. But in a short video, I have told before that it's not possible to say more than this. And here is just the example that the pictorial form and how the stepwise and the picture and along with flow chart, all the things are given. So this was overall what the book contains, but you have to go through this book to understand it well. So stay healthy, keep smiling. Thanks for watching.